Hello everyone and welcome to our YouTube channel. Today we're delving into a fascinating topic, navigating neurological diagnosis, tests and procedures. We'll break down complex medical procedures into simple terms, giving you a clear understanding of what these tests are all about. Our first stop is the EEG, or electroencephalogram. Now I know that might sound like a mouthful, but it's essentially a test that records your brain's electrical activity. Imagine it as a way to capture an electric fingerprint of your brain. During an EEG, small electrodes are placed on your scalp. These electrodes pick up electrical signals generated by your brain cells. The results are displayed as wavy lines on a monitor. These patterns can reveal if your brain is functioning normally or if there are irregularities. When might you need an EEG? Well, it's often used to diagnose conditions like epilepsy, assess brain injuries, or even to monitor brain activity during surgery. Next, we have the MRI, or magnetic resonance imaging. It's that giant machine that takes detailed images of your brain and spinal cord without any surgery. How does it work? Well, MRI uses a strong magnetic field and radio waves to create these images. The machine essentially lines up the protons in your body and then knocks them out of alignment. When these protons realign, they release energy, and that energy is what's used to create the images. When do you need an MRI? It's incredibly useful for detecting a wide range of conditions, from brain tumors and multiple sclerosis to spinal cord injuries. Moving on to the CT scan or computed tomography. Think of this as a way to take detailed cross-sectional images of your brain and other body parts. It's a bit like slicing a loaf of bread, but without a knife. CT scans work by combining multiple X-ray images taken from different angles. A computer processes these images to create detailed cross-sectional views. This helps doctors spot issues in the brain, such as bleeding, tumors, or damage resulting from head injuries. Now let's explore lumbar puncture, a procedure that involves drawing a sample of cerebrospinal fluid from your spinal column. During a lumbar puncture, you'll be asked to lie on your side, and a needle is inserted into the lower part of your spine. A small amount of cerebrospinal fluid is then collected and sent for testing. Why is this done? Lumbar punctures help diagnose conditions like infections, bleeding, and multiple sclerosis. They provide valuable information about the health of your nervous system. Lastly, we'll dive into EMG and NCS. Electromyography and nerve conduction studies are used to evaluate the electrical activity in your muscles and nerves. EMG involves the placement of small needles, called electrodes, into your muscles. These electrodes pick up electrical signals, helping doctors determine if a muscle condition is causing your symptoms. Nerve conduction studies, on the other hand, involve the use of small shocks to stimulate your nerves. By measuring how quickly electrical impulses travel along your nerves, doctors can diagnose conditions like carpal tunnel syndrome or peripheral neuropathy. We've just scratched the surface of these essential neurological tests and procedures. Understanding what to expect during these diagnostic processes is a vital part of taking control of your health. If you have questions or want more information on any of these tests, please leave a comment below and we'll be happy to provide additional insights. Thank you for joining us today. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more informative content.